So thank you everyone for coming. I'm really glad there's lots of people here because I'm sort of trusting that your expertise on this will complement my areas of interest and knowledge and preparation. So yeah, I mean, as Laura was saying, some of this content is informed by the work that I've done with people who are in prison or experience imprisonment. And then I really welcome your contributions, questions as we're going through, because I think this is something that all of us think about and encounter in different ways as we're doing our work and research. So I'm going to do, I guess, 4 things in general, talk about what vulnerability means, and then talk about risks for vulnerable populations and both participating in research and then not participating in research, and then talk about some practical considerations for working with vulnerable populations, and especially that part, I hope that people can give examples of their own work. So to start out, I wanted to know what people think when you hear what is a vulnerable population. And anytime people don't answer, it goes to Larkin. So step up or you'll be getting in trouble later. Go ahead, John.
See, any group of people for whom there might be restrictions on their ability to give consent or to refuse participating for either a real or perceived concern that it will impact either the receipt of services or put them in a situation they don't want to be in.
Okay, so it sounds like you're talking about 2 parts. First of all, inability to provide informed consent, and then that's a problem because it might lead to them being in a bad situation of some kind. Did I get anything else you wanted to add to that?
I guess just if they feel that if they refuse, that then there's going to be negative consequences because of that.
Okay. Anything else? Pam?
Yeah, that's why my jaw's on. I think of a vulnerable population as a population or people who have limited income, limited housing, limited education, not able to access resources the way others who have those attributes could access it. So they're vulnerable because they don't have those assets.
And so can you connect that to why that makes them vulnerable within research? They don't have assets, and so can you connect that to me to how does that make them vulnerable?
Well, I guess there would be a number, but I think trust and engaging them in research, it's like in any population where we want to be learning about them. Do they benefit from that learning? Do they hear back the results of what they contributed to? Are they fully aware of what they're participating in and how that information is going to be used?
Okay, so you're sort of connecting less assets or maybe disenfranchised and not being able to benefit from research or learn about research in the same way that other people might? Is that?
Well, I'm just thinking vulnerable populations may be drawn into research because they're going to help us learn something, but what do they get back?
Right. Yeah.
From it?
Yeah, makes sense. Go ahead.
I would kind of build off that, but kind of look at it in an opposite way. It would be harder to contact them because they don't have as many assets. Or maybe they can't leave their job. I know for one of the studies we're doing in the Philippines, one of the vulnerable populations we're trying to reach, but it's challenging too, is people who can't participate in the sessions that we have because they can't leave their job and they are really reliable. They need to rely on certain transit routes, so they can't change them. So we can't even engage this population because they can't leave their normal life because they can't miss a single day of work. And then even mailing to people, I know there are some people who maybe start in a study and then they move, or maybe they're in a shelter and their address is the Good Shepherd Center. And then they move and we can never contact them again. So then it's just the full process of research is difficult to engage with them in.
Yeah, I mean, I think there's a lot of different points in there that are like important to draw out. So one of them is that it can be harder, like more work to do research with vulnerable populations. And another thing that like you didn't quite get to, but like in terms of contacting people, let's say somebody's at a shelter. Well, even if they're still at that shelter, you probably have to go through someone else. So like the fact of their research participation might no longer be confidential like it would for somebody like me, where I can be contacted through my cell phone or my address. Somebody else have a point? Gina?
So I think something very simple as language makes people very vulnerable. So I would say in our context, non-English speakers would be vulnerable because the communication will be difficult for research and for all kinds of other things.
Yeah.
And also then we don't include them actually. That's what ends up happening. You don't include them, and then those individuals who don't speak English don't have a voice in some big health system research pieces.
Yeah, absolutely. And we'll come back to that a bit, like the consequences of this. So actually it was really interesting to me when I did just like a Google search for images on vulnerable. I got this one, which I think sort of speaks for itself. But the other ones, I kept finding these images of like a woman cowering in the corner and like a fist in the front, like different variations of that. And it was just, like it's interesting that would be, anyway, it wasn't like there was no systematic aspect to this search. It was just like the first page. But it was sort of striking because I was looking about research in particular. So is everybody here familiar with the Belmont Report? So this is like a landmark report from the United States in 1979, which defined some of the basic principles of research ethics. They used this term vulnerability for the first time, and they talked about an increased risk of harm or wrong. So I think we were talking before about both what makes you vulnerable and then what the risks of vulnerability are. So Jeff, I tried to sort of split those two things out. And like Pam and Gina, you were talking about a couple of characteristics, and Fiona about like things that would make people vulnerable, but then vulnerable to what? Like what are we worried about here? So it's sort of vaguely defined as increased risk of harm or wrong. And I mean, just to say that when an REB looks at your research, they're thinking, are the risks and benefits appropriately balanced? And Pam, I think you got at that a bit. Is the proposed strategy for recruitment fair? And will voluntary informed consent be sought from each potential subject? And so I just made a little note for myself here. So some people worry about vulnerability in terms of this, is recruitment fair? So that might be that you're systematically excluding people that should be included. It might be that people would feel undue pressure to participate. And again, we'll come back to some of these things. And other people think that it's more about this, voluntary informed consent can't be obtained because of characteristics of that group or individual. So, and then also people think that sometimes the risks and benefits aren't appropriately balanced. So like people in prisons, they used to do all kinds of research on treatments that wouldn't be directly relevant given the burden of disease in this population. So these two kinds of arguments, it's justice as the principle that is sort of at risk in terms of vulnerability, whereas this one, I have to write this down because it's like stuff that isn't so familiar to me. This one's more about autonomy and respect for persons. Let me just see if I wrote anything else. Yeah, and so then how broadly or narrowly should vulnerability be defined? So this, I think, is quite tricky. Like, obviously, every group of people, however you want to draw circles around a population based on different characteristics and different individuals within each population, we all have sort of a degree of vulnerability. It's not just, are you vulnerable or are you not vulnerable? So thinking about, like, how much protection of subjects needs to be in place and how do we balance that versus the benefits of participation in research. So now I'll just go on to a couple of definitions of a vulnerable population. So the Tri-Council policy statement says a diminished ability to fully safeguard one's own interests, which I think is like a really interesting language that we would have clear interests and how can I protect my own interests? in the context of a specific research project. So this can be caused either by limited decision-making capacity or limited access to social goods. So again, that came out in our discussion. So that can be rights, opportunities, and power. And individuals or groups may experience vulnerability to different degrees and at different times depending on their circumstances. So, as a specific example, typically women who are pregnant are considered vulnerable, so you can go in and out of that state. Or if you're thinking about people in prison, same thing, you go in and out of prison. But other things like childhood, you end your childhood. But other groups, like, what are fixed characteristics? Like certain racial or ethnic groups, you might consider vulnerability. Hopefully socioeconomic status can be more a state as opposed to sort of fixed. And then this is a U.S. organization, the Council for the International Organizations of Medical Sciences. So they're saying vulnerability refers to a substantial incapacity to protect one's own interests. So same thing. So you as an individual or as a group have interests and you can't protect those. So lack of capability to give informed consent can cause that. Lack of alternative means of obtaining medical care or other expensive necessities. I think you got at that a little bit, Jeff. You won't have choices. Or being a junior or subordinate member of a hierarchical group. So I think this one's interesting for lots of us who have been in roles as learners or had a boss, which is probably all of us. So there was a review paper that was published, I think last year, it's in the references, which you can look at. And it basically said, this concept of vulnerability is in so many sort of formal ethics documents, but it's not actually defined clearly except in these two major sources. And this is across. So a lot of ethics documents will define what vulnerable populations are, but they don't go into what makes you vulnerable, which I think is interesting. And then this is just I think important to think about because when we think about vulnerability, it can be because of both characteristics of the person or characteristics of the situation you're in. So, I think that's good to think in mind because usually I think about the intrinsic characteristics of an individual, but not so much the situation. And of course, being in prison, for example, would be the situation you're in. Being in hospital or being acutely ill, those kinds of things would be other examples also. Okay, so, we've talked a little bit about this already, but does anybody have any other thoughts on risks of research participation? Like when we talk about protecting people, what are we trying to protect people against? Or from, I guess?
Continuity of care. You want to make sure that is maintained.
Okay, so you mean that...
There might be a break in continuity.
So if people participate in research, it might compromise their access to care in some way. Okay, yeah. Okay, maybe this question's a bit too vague.
I've got one.
Answer one.
Yeah, go ahead.
Some topics might be a little bit more sensitive to certain populations. So some of the risks might be like emotional trauma or things like that in talking out, especially if you're doing in-depth interviews.
Yeah, I think that's an interesting one because I feel like I read a lot about, participation in this research study can be therapeutic for people. And in some ways it suggests maybe people don't have an alternative way to have a therapeutic experience. You need to participate in this research study. But also, there's the potential for harms as well as benefits from that. Okay.
Think of social risks, so certain disclosure of mental illnesses or medical status like HIV, things that are there's stigma attached to them, and so protecting if that person discloses something, maybe to at risk, social risk, losing their job,
Yeah.
their employment.
Okay. So emotional, social, Jen?
This might be a little off tangent, but the idea of that time-limited support that they receive while in research, and then the study ends, and then they're sort of let loose and can possibly fall further or whatever. So I think a continuum of care past research is an important aspect. And then the only other thought is sort of the idea of what conclusions you draw from research on vulnerable populations if that population you're studying is not representative enough. And so it's the idea of building knowledge but not full knowledge if you're not getting the complete answer.
And like, why would that be different for vulnerable populations as opposed to the general, like, or non-vulnerable populations, let's say, like the last part?
I think just because of the paucity of research on those populations.
Okay, so we know less, so if you find one bit, but you don't have the other 19, whereas for non-vulnerable populations, you might assume you'd have, just using 20 as a denominator for some reason, 10 bits, and then you'd have a bit more of an understanding of context or, okay, that makes sense. Yeah, Casey?
I mean, I might add on to that the idea of misuse of the research data or the sort of the conclusions of it. So you could, someone could use the fact that this research has been done and found these things to justify something that without any research couldn't have been sort of like justified in the public realm, even though that might not be an apt justification. So it's sort of like saying, oh, we did this study and now we have a justification to further marginalize a marginalized group or something. But that's a risk of participating in research is becoming a pawn.
Right. Yeah, and it could be like pawn, I think, suggests like intentionality, and it could be intentional or unintentional. Right. Yeah, I mean, I've heard this talked about quite a bit recently, like the last couple of years with, Indigenous health issues, and like I think that there has been, understandably, like a lot of interest in looking at really poor health status in various groups, Indigenous groups in Canada. But at the same time, like I've heard advocacy from Indigenous groups, like we want to flip this and talk about strengths and resiliency and not just focus on problems. And so, yeah, how do we explore important issues and frame them adequately, I think is quite challenging, and we can come to some solutions afterward.
I was going to say just the fact that there's less research done in this groups also kind of makes a lack of generalizability of some study results can't be generalized to those populations. So, if all your research is being done with like non-vulnerable groups and you try to apply those results to a vulnerable group, it could not have the same results. It could actively cause harm just because of differences in contexts and characteristics.
Yeah, absolutely. Although I think that gets the next question, which is the risks of not participating.
Yeah.
But it's both. I'll say it's both.
I guess so.
Doing research could also like set up the expectation for change. So like thinking of Indigenous groups, like uncovering problems could say, and then what? And like this population might be left feeling like it's going to result in change, but it might not necessarily.
Yeah, I mean, I think this is really heavy, right? Like our work in research is heavy. Like we sort of take on, we're not just trying to publish papers. We're trying to like support change, desired change, and we can't always do that, or we can't always do it right now. Mm-hmm. Okay.
I was just going to say about your comment about the uncovering problems, and I know there's a lot of debate around the word vulnerable in the literature. There's a paper, I think it came out in 2018 in CVJ about that word. Now, not necessarily as linked to research, but just when we say vulnerable populations, that's actually, there's a lot of negative connotation with that versus other terms like underserved has been thrown up there.
Yeah.
So I think the word vulnerable, even in this context, I don't know, it doesn't sit great with me, I guess.
Yeah, thanks for not giving me a heads up on that article. Like,
I think circulate.
but it matters, right? Like our language matters. I mean, like when you said that, I think about like a word like victim versus survivor of abuse or something like that, right? It really matters. And by using a word vulnerable, is it sort of taking away agency from people? Anyway, I mean, I think there's a lot of really interesting content here, right? Like the paternalism of protecting people from research and sort of assuming that people don't have capacity, but by group in particular, I think is really problematic. So yeah, like how do we sort of balance these things and not take on too much power? And language is huge, right? So I didn't take that on squarely, but I'm happy that you raised it. And I know I was sort of being facetious before, but
I think it gets at to the concept of research. Assume like there could be this assumption that change is going to happen, and so when you do research, change. I mean, there's a social justice component that I think has to happen when working with vulnerable, even though I hate that word, populations.
What do you mean by that?
Well, I think there's been a lot of tokenism. There's funding out there. These structures, we need to throw money at understanding Indigenous health is a very hot topic right now. But there's, I think there's research that's done not with the social justice lens, and it needs to be. So, I know the work you do, you're working with people. You are. So there's, I guess, it's that social, it's not just publishing the paper. It's gotta change somewhere, whether it's now or later, it has to be working toward that.
Yeah, I mean, I often think about that. Like, when on a paper where I say, like, do you have a conflict of interest? I'm like, well, my whole career is basically, like, resting on me publishing, so I sort of do have a conflict of interest here. But, yeah, absolutely. And I'll come back to that in terms of some of the practical strategies, which, like, I went like this because, like, I want to do that better, and I don't think I do it as well as I could or should. But going back to what you were saying before, like, it's hard. It's hard to do this kind of work well. Like it's hard in terms of resources, but I think also emotionally it can be challenging, and like conceptually it can be challenging. Like I think there's a lot of different aspects of it. I think maybe 2 points or 3 points, and we'll go on.
Or
no, you're talking.
I was just going to say, like, on the topic of the term vulnerability, I think in conceiving of it as you've pointed out via the definitions, intrinsic and extrinsic qualities, so that expanding our understanding of that we've all moved through zones of vulnerability in all of our lives, like understanding that wholer view instead of using that term in a dichotomous way, and othering and all of that.
Yeah.
That has to be understood. I mean, according to police, the children of vulnerable populations, so you go and get your screening done to work with those populations. So we have all been there, and in other ways, right? So just, we have all these terms that contain sort of how they are conceived of, and we try and expand on that a little bit in how we define the population and the work that we do.
Yeah, absolutely. Gotcha.
I wonder if there are sort of historical connotations to the term. And so you talked about vulnerability sort of implying a lack of agency, but isn't that essentially what it was before we started developing guidelines and laws for dealing with these kinds of populations? So, like specifically to bring in like incarcerated people, 100 years ago or more, they had no agency, and if someone wanted to do an experiment on them, they really could, and the person had no say in it. Especially if they were already like a condemned prisoner, they're basically considered dead already, and so had no rights. So I think they're, while hopefully we've changed to enough degree that maybe vulnerable is no longer the right word. It seems like it came about sort of for the right reasons, because there were these groups who really had no say and had things done to them. Where people serving in the military would be another example. Like I said, we're going to expose you to this and see what happens. And
But I don't
service,
think
right?
today we can have the conversation about whether things that were appropriate at a different time should still be considered appropriate now. No, I'm just kidding. Yeah, like it's sort of like, should we be looking at things like recognizing that historically that was an appropriate term, and yet what are the implications of that term now, and does it have problematic impacts on, well, so first of all, is it unfair? Is it an unfair label? And then second of all, what are the impacts, whether it's fair or not, what are the impacts of that? And do people identify with that term when we impose, might be too strong, but impose it on other people? Pam?
Well, the comment I was going to make pertained to previously, but I just on this one, I think language evolves. I think that as we come up with these terms, we come up with them for a particular reason, and then as we learn more, we realize, oh, okay, no, maybe that's not the right thing. But it's just recognizing that language and understanding continues to evolve. I like that idea of the continuum. The other comment I was going to make is that I think, particularly for somebody in your role, and actually the work that Jean and her team does, is when you're working with populations, however we're going to describe them, less advantaged than ourselves. I think what's really difficult is after the publication, there's that responsibility of now what am I going to do with this, because you're up against a huge system, and so you're engaging these populations, you're learning from them, you're seeing what needs to happen differently, but like how do you that responsibility of taking it that next step is I'm sure quite a challenge. So I'm glad you're doing it.
For us.
Yeah.
Okay, I'm just gonna move through. We've covered most of this. So we talked about coercion and undue influence. So, I mean, I just put in a couple of examples from my work. So I'm working on a study protocol right now with people with the Correctional Service of Canada, so people who are in federal prisons. And Jenna's not here, right? She's probably like, I'm so sick of reading about her work. But anyway, so.
Oh, Jenna.
Yes, she's at CFM.
No, it's fine. I know you're here. So anyway, so typically when you're doing a research study, you're not supposed to have somebody in your healthcare team directly recruiting you. They could tell you about a study that somebody else, and then they refer you. Anyway, I don't know all the ins and outs of this, but basically in this study, the Correctional Service of Canada, so the people that administer federal prisons, have no funding to hire research staff. So they are going to have institutional nurses approach people and talk to them about the study. And I talked to the REB about this, and they were basically like, that's not standard practice for recruitment. But if that's the only way you can move this research forward, then I guess it's okay. So like sort of explicitly balancing, like these are the pros of doing this, these are the cons of doing this, but we want to support research with this population. So, I feel uncomfortable about this. Is it so uncomfortable that we stop the study, we don't do the study? No, but happy to be criticized or have other thoughts on this after. So yeah, that can be due to capacity or limited choice. So again, like if they said no to the nurse and then the nurse gives them a hard time or, whatever, just it's not like your sort of independent choice. You might perceive that there will be some consequences even though we write in the information and consent form that there will be no consequences. Who knows if that's true? So the next one, lack of protection for confidentiality. So in the jail on Barton Street, we've done some focus groups and talked to women about their experiences of pregnancy and their need and desires for contraception. And in the jail, like when I see a patient, there's an officer usually in the room or just outside the room. And similarly, when there's a focus group, it really depends on what the officer is comfortable with. So usually they're happy if they can like maintain a line of sight on people, but often the door's not closed. So if somebody said something, and it might not be, like it could even just be like, the people treat me really badly in here, and then somebody overheard that, then who knows, right? Like how do we respond to that kind of information, especially if it's seen as a personal criticism? So yeah, I worry about that. Can we absolutely protect confidentiality? No. And then the last point, well, the third bullet here, risks are disproportionately high compared with the benefits. So, I think traditionally this has been a bigger issue in incarcerated populations just in terms of what I was saying before, that in particular medication treatments and trials being done to look at the impacts of medications that wouldn't necessarily be appropriate for that population. But yeah, so how do we sort of weigh the risks compared with the benefits? And then, just as we said before, we need to put in place safeguards that protect the rights and welfare of potential research subjects. So risks of exclusion from research. So we talked about this a little bit. Maybe I'll just keep going. Just a couple of things from the Tri-Council policy. So participation should be based on inclusion criteria that are justified by the research question. So this isn't based on just like, what's a convenient sample, right? You need to think about who are the people that this research question I'll use the word should involve, and how do I include those people? So inequity is created when particular groups fail to receive fair benefits, or when groups are excluded from research arbitrarily or for reasons unrelated to the research question. So, for many people in this room who might not have a particular focus on vulnerable or marginalized populations, or, we can, again, the language question obviously is problematic. That might be an important thing to think about. How are we including people who are within groups that are vulnerable? And then from the U.S. National Bioethics Advisory Commission, so people should have the opportunity to participate in research if they wish to do so and if they're considered to be appropriate participants. Yes, we need safeguards, but once those are established, you shouldn't exclude people who are vulnerable from research involving greater than minimal risk, because this would deprive them of the benefits, as well as depriving their communities and society from the benefit of the knowledge. So, this is a huge issue. I think there's a few groups that I usually think about when I think about exclusion from research. So for sure, children and pregnant women and prisoners. And I think part of this is, and maybe going back to what you were saying, for historically really good reasons. People in prisons were taken advantage of in terms of research participation, and their rights were denied. So then we sort of swing the pendulum the other way. We're going to protect you from participation in research, but then we don't know anything. We don't know anything about what the problems. We don't know anything about the appropriate interventions. So how do we do that? And for anyone who has tried to look up medications in pregnancy or many medications for children, it's all we don't have enough information to say whether this is safe or not safe. So this sort of exclusion from research doesn't have a neutral impact, right? This is really substantial impacts on, being able to develop appropriate interventions, whether it's individual level treatment or implementing interventions at a community or institutional level for people in prisons. This is just to mention, we've tried to look at this systematically. So colleagues and I looked at all CIHR funding and tried to identify funding that had a focus on people in prisons. And we basically looked at 5 years of grants, and we found that over 5 years there were 21 grants that were awarded that had a focus on prison health research for a total of $2.3 million. And so that means that this translates into 1 in 1,000 grants and about 5 cents spent on this population for every $100. So, to my mind, I know you can say, well, what's the right amount of money to spend on prison health research? And I don't know. But if you think about issues of equity, burden of disease, all the justifications that we might have to focus on a certain population or setting, this population needs some funding.
Not to discount that message, I'm just wondering, when you're looking at that population and it's 5 cents per $100, how large is that population relative to other populations where the bulk of the money is being spent? Do you see what I'm saying? Totally. And you have to ask those questions, right? Because this isn't about, in a vacuum, how much money should be spent. It's this or that, right? There's a fixed budget CIHR, unless there's really good advocacy from various groups to increase the total budget, but it's a fixed envelope. Yeah. So if I think about it from a basic, what's the population size? So if we say 1 in 300 people spends time in prison per year, we could go with that. Or we could say the health is worse. So hepatitis C cases, 1 in 9 spend time in prison every year. So there's different ways to think that through. But
I can say this isn't enough, but I can't say this is the perfect amount. This should be our target.
No, and you've answered that in terms of there would be different variables to determine, but I just sort of thought, well, what is the population within health risks? To influence what would be a good number.
What
to
would be?
advocate for.
Yeah, exactly.
I'm sure it's more than 5 times.
Yeah. And also this sort of does assume the exclusion of this population from other studies, which isn't always true, but I think is often true. So anyway, I mean, this isn't like the be-all, end-all, but it's just to give you a sense that like there are ways to actually look at this, sort of to quantify it. I'm into the practical strategies. Did anybody have any other comments before we move on to that? About this or exclusion, inclusion issues? No. So I just have 2 sort of broad practical strategies that I think both of which have already come up. The first is collaborate, and the second is that you have to work harder on KT with colleagues. So this one, okay, so this first point, recognize that you may lack subject matter expertise. So I think that this is like very counterintuitive for those of us who spend a lot of our careers like trying to convince ourselves and convince other people about how great we are and what experts we are. This sort of demands that you recognize that you're not the expert. I mean, this is assuming that you're a researcher who isn't part of the vulnerable population that you're doing. Like, obviously, there's exceptions to that. You have to sort of step out of that I'm an expert role, or, I have expertise in these things, but these things I need to learn from you and collaborate with you on. I think that that's challenging to those of us who are always trying to convince others of our expertise. And involve people in the vulnerable population and research at every stage. So that can be as basic as what are the research priorities. Like my first research project in the jail in Hamilton was about gonorrhea and chlamydia. So that's a big issue in this population. But is it the issue that like people who are in the jail in Hamilton would pick for me to focus on? I don't think so. Like I just think it's like they might say like, and I haven't asked them actually, so I don't know, but I can imagine now thinking back that people would probably say, I need housing when I get out, or people treat me badly in this jail, or other things that are sort of more pressing issues that have a bigger impact on people's lives. So was it wrong for me to do that study? Maybe. Maybe. But anyway, so better to have established relationships, define common ground for areas that you have adequate content expertise or methods expertise, and move research together collaboratively. So I've done some, that's still on the what are research priorities, I've done some work to try to do like consensus building activities, what should be research priorities in this area, but I haven't very successfully included people with lived experience of imprisonment, mostly because it can be challenging to access that group. But like we've done Delphi studies and that kind of stuff, what should priorities be? And then the next bullet, what are the best procedures? So this is just like, if you want things to work, like don't assume you know. So I've just put in a few examples. So the first example being research on admission. So I had this idea, like I'm an epidemiologist, people are in for varying lengths of time. If I want to catch everybody, I have to catch them the minute they come in, because 12 hours later some people will be discharged. Maybe those people are the people we need to be intervening on. But of course, like I didn't think about the fact that when people first get into jail, they're really upset, they're drunk, they're high, they're scared. Like that's not the best time to be like asking people a whole bunch of questions and asking for samples, right? So I quickly realized that despite the fact that from a science perspective it seems like that's the best time to talk to people, it isn't actually the best time to talk to people. And this one was interesting. So this is still the gonorrhea and chlamydia study, collecting urine samples. So at 2 points there was like sort of a lull in terms of recruiting people to participate in this study, which was calculating the prevalence of gonorrhea and chlamydia. The first time people thought that we were collecting their urine to test them for drugs and not telling them. And then the second time, they thought we were collecting urines and storing them so we could test their DNA. And I was like, I don't even know if that's possible, but we're not. But like, you know, how am I communicating to be able to address those things that obviously people are really worried about? And then the last one I think is like an interesting thing that probably like many of you have thought about in the studies that you've been working on, compensation. So yeah, like people, we might assume this is what people want in terms of compensation, like a gift certificate for this place, or, but to some extent, like we just don't know what are people's priorities unless, you know, we ask a whole bunch of people. But even so, within a group, there's variation. So I've moved to giving people cash so that they have the opportunity to choose. This is what I get $30 for this. I don't want to spend it on a donut. I want to spend it on groceries or crack or whatever they want to spend it on, right? So I wouldn't impose that on somebody. So anyway, that's probably arguable, and I'm sure there's some feelings on that in the room. But yeah, so that's been interesting for me to think through. And then the last part is just to say, as I was sort of hinting at here with the procedures, that it works better to involve people, but it's also most appropriate to do that. Like it's the right thing to do, and it works better. So, you know, just to say that this term, nothing about us without us, which I read a little bit about for this presentation. So I guess it comes actually from Eastern European political, like early 20th century thinking. And then it sort of was championed, I think, in the early 1990s in the disability movement. Another problematic term. But yeah, and now it's used by all kinds of groups. So yeah, like people with HIV, I've heard this used. Can anybody think of other examples? Indigenous groups, yeah. So this is a really common sentiment, and I think it makes a lot of sense, but practically is hard to do. And then the second practical strategy is do your own knowledge translation. So yeah, like sometimes I think, what if I worked in breast cancer research? Like I have this idea that, you know, people would just like, you have a finding and then like there's 10 researchers who just grab it and they move to implementation science, and there's all these funders that are like waiting to like do it and scale it up. And that's not the case in a lot of work with vulnerable populations. So you need to figure out how you get your findings and make them matter in whatever way that is. So I said develop or support coalitions, identify champions, work with partners to interpret data and avoid stigma. So I think that came up already. And you know, one specific example of this, I'm working on a project about the overrepresentation of people who are Black in provincial prisons in Ontario, and like to my mind is like horrific. Like I can't remember the exact number, the exact age group, but it's basically like 18 to let's say 30, but I can give you the exact numbers if you want. Men who are 18 to 30, Black men, it's 1 in 14 Black men in that age group who spend time in a provincial prison each year. So I'm like shocked by this, but you can just imagine how easily that could be twisted into Black men are committing crimes at an unacceptable rate. So how do we say, like, you know, there's obviously problems in this justice system that are leading to this huge overrepresentation of young Black men in our prisons. So yeah, I mean, I'm collaborating with somebody who has a lot of experience and is a young Black man. Well, I don't know exactly how old he is, but he's pretty young. So, yeah, I mean, that doesn't mean I can just like, then I don't have to worry about it. Of course, you still have to worry about it. But yeah, like you can just, this issue of sort of championing and avoiding stigma, I think is a really big thing that we have to think about. And then the last point, which I think probably people have heard me talk about before, is that we have to use different arguments to advance work. So I think like a lot of times people will just talk about costs and when you're talking about vulnerable populations, people will talk about social justice or human rights. But I think we really need to use all kinds of arguments. So what's the burden of health? And you can think, what's politically hot right now? What's the impact of the health of prisoners on hallway medicine? Or, like whatever the specific angles are. And I mean, obviously, like could be legal arguments that you can use, and so that's a different route to go. But so sort of how do you appeal? And this is both to grow your coalition at the top line, but also because the people that you're working with to make change have different interests. So figuring out the best way to engage with people to affect change, I think, is really important. Does anybody have any examples of collaboration, things that worked or didn't work, or KT stuff that worked or didn't work, that they want to share with vulnerable populations in mind?
I had a question. This relates to the study I'm working on with Robin Lennox and people who inject drugs. So I'm wondering if you've had any challenges with ethics boards trying to think outside the box to really engage certain populations, and the ethics boards kind of putting on the brakes because whatever safeguards you've put in or that out of the box thinking doesn't sit well with ethics boards. So for example, this population doesn't have a phone, is homeless, houseless. So try to really get those people engaged in the research process. And so we had thought, scrap written consent, because that's, like, you can't say email it back to me, mail it back to me, any of that. Might not be able to meet in person, but we could maybe do something over the phone. They can use the phone at the doctor's office, I don't know. So let's scrap written consent and get something verbal consent for basically an interview. And so that wasn't good enough. That wasn't good enough safeguard to, all the not using names, et cetera, And so we had to get written consent. So it splits out a segment of that population that might benefit from the findings. So how do you, I don't know, I'm just wondering, what's your take on that?
Yeah, I mean, in my experience with this REB, the high reb, they'll often ask questions and push back, but if I can provide a solid justification, I haven't had problems.
Not recorded. I've actually had that with a bank before where they said we're about to play a recording and then at the end we need to say like I agree to whatever, and they actually keep that recording.
Yeah, it wasn't like, there's a lot of things that wasn't good enough. We just kind of we needed ethics, just the whole research process, and then we're like, fine, and then maybe revisit that, with an amendment. Hey, we haven't had any challenges, now can we move to doing, recording consent, doing consent in a different way.
Mm-hmm.
But I was just curious.
Yeah, I mean, I'm working, that study that I just mentioned, which is about bloodborne infections, which obviously there's a lot of controversial history about bloodborne infection research in prison, but, and we aren't going to collect, we're not going to get written, our proposal is that we won't get written consent because people don't want to have their name associated with a test result. And there's that's explored in the Tri-Council policy, so it's hard for me to imagine that wouldn't be acceptable if you provide a strong justification for it. I mean, I would just say, anytime you get a paper sent back with questions or comments from a reviewer you don't like, you just push back in a lovely and deferential way. But yeah, I mean, the time is every time you do it, it takes weeks, and then you're yeah. I know we only have a few minutes left. Yes? You gotta lean in, get it to the table.
Very quickly, say when I went to Trillium in the spring, I heard they talk about Jennifer Walker, so she's an ISIS scientist and dealing with indigenous populations, and she provided an excellent, she was a keynote actually, on her area, whatever you call it, about engagement of populations for research and a whole new terms of engagement and working with the elders and just a very different context altogether. The many things, but I remember she said, and the PIs shall not be called doctored. there's just titles and everything. It was a whole other. And then obviously the idea of bringing that research knowledge back to the community was huge. And also the protectionism of their health data as interpreted as stories in a spiritual entity. So that was another interesting.
There's
Thanks.
Health Tapestry, one of the first Health Tapestry collaboration with Sturgeon Lake First Nations. So Vivian, some of you may know her. They have decided they are now ready to publish 13 articles as a community. It's a special edition somewhere. I'm sure we will hear about it. But it was the same thing where, trying to think of knowledge translation in these structures that are colonial is a challenge. So there had to be some negotiation with how that would look like. It had to be stories. They own the rights, all that. But I don't know why it can't be done all the time like that.
I have a question kind of about the opposite problem of being a part of the community and doing research in that community. So like what's the best way to approach a situation where people won't participate because the researcher is part of the community? Do you just like hire a person who's outside of it to work with you? Like I'm not sure or not do the research at all.
I haven't thought about that, but off the top of my head, but I'll talk about it anyway. I guess I would think exploring why that's an issue is important. Like, is it about confidentiality? Is it about why would that be a barrier for people wanting to participate? Because that might lead you to the solution.
I think I would say a little bit confidentiality, but also I think the idea of somebody in the community knowing about not deep dark secrets, but just whatever happens in the interview, that somebody else in the community knows.
Yeah. Does anybody else have any suggestions or thoughts on that?
There's a lot about that in qualitative, so I don't know what kind of project it is, but just the position of the researcher, you're usually often a part of that community or a group in some way, or sometimes you are not, but it's negotiating your identity and status as an insider or an outsider to the research. So usually you're just being upfront about how you're positioning yourself in relation to what you're learning and how it's being used.
I think
so
it's
very common.
Participating. People don't want to participate as participants in the research.
Right.
Because it's not so much about the research.
But then I guess that's so you have to figure out why, Fiona is saying, and then if it's a barrier to participation, then you have a problem.
Mm-hmm.
Yeah.
In that case, though, would it be different if you were an outsider coming in and you're doing the qualitative, you're becoming a part of that group and its interpretation versus actually being a member of the group and then doing that?
Yeah.
That would be different.
So would they feel more comfortable with that so-called outsider?
Who becomes a part of the group, but doesn't have a relationship.
But
you could explicitly.
Literature, I think, is dealt with a lot in terms of those kinds of issues and challenges.
Like in anthropology research, for example. Yeah, obviously there's simple things like you can put in the information and consent that you're not going to, that kind of stuff, but it's probably more complicated than that. Just because of time, I'm just going to, I've finished the content. So in summary, support access to research participation for vulnerable populations when appropriate based on your research question or topic, and put in place appropriate safeguards. Collaborate with people in vulnerable populations to ensure that you have the best research focus and research procedures, and work hard on your KT. And this is the part of what I was supposed to do. This is my summary, most important sentence slide. That's it. I'm happy to talk about these issues with anybody who wants to. And yeah, as I said, not an area of expertise. In fact, I didn't even come up with the topic, but yes, unfortunately I have a meeting at 2, so I can only stay for a minute or two right now. But
Okay, so time for a question or two before Fiona has to go. Anyone? Or comment? Well, we know where to find you. So, but thank you for this, and also for allowing us to really engage through your discussion with us at the beginning, and have everybody think about this a little bit more. So thank you.
thank you all for all your participation.